surprises me if you're on the front lines trying to treat people you've never even heard of the Surgisphere, which probably turned off a lot of doctors like you who rely on the New England Journal of Medicine, even though Dr. Mark Angel said you really shouldn't or can't. Done that. But let's move on. I think Mr. Sirius kind of covered the 154 million, which was the first time I heard that. And again, I would call that propaganda. It's not science. I mean, somebody's got some model, fine. I mean, I can play with numbers too. As a matter of fact, I'm going to show you how you can use numbers. Dr. Scott, you talked about the Commonwealth estimate of 3.2 million lives saved here in the U.S. in 2021 and 2022, correct? You're pretty confident of that one?
It's one of a few studies. Yep, these estimates are not easy to make, but yeah, that's one study.
Define study. I mean, were there confidence intervals around that 3.2 million?
It was a modeling study, yeah.
It was published on a blog, wasn't it? Is that correct, Mr. Siri?
Yeah, it's a blog.
That study was covered on a...
Yeah, the Commonwealth quote-unquote study is not a study, it's a blog. It's not a peer-reviewed study, it's not in a journal, it was published on a blog.
Let's put up this little chart that I'm somewhat famous for charts. So let's look at real data. So this is CDC data. So in 2019, total deaths in the U.S. were 2.85 million. Okay, then we have the pandemic year, 2020, 3.38 million.
To COVID. I know other doctors in that similar situation using budesonide and so forth.
Dr. Rogers, you have something? Dr. Scott, I think you wanted to say something?
Yeah, I want to add to this debate. So I watched every single meeting of the Advisory Committee on Immunization Practices and the Vaccines and Related Biological Products Advisory Committee in 2021, 2022, and 2023 when all these COVID shots were being authorized for use in this country. And after a while, the CDC's own research showed that the protection from the vaccine, if any, was between months 2 and 6. And by 6 months, it showed negative efficacy. So I'm watching the hearings on my, computer screen at home. I'm yelling at the screen. The COVID shots have negative efficacy after 6 months. Tell me how a shot with negative efficacy is saving lives, and it has the worst side effect profile of any vaccine in human history. So how exactly is a vaccine with the worst side effects and negative efficacy saving lives? That's a preposterous claim. What ended the COVID pandemic was the Omicron variant that was more transmissible but less lethal. The vaccine, how many people it helped? I think it's an open debate. It could be a net negative.
Well, maybe we can look at the clinical trial data in which 21 people died in the vaccinated group and 17 died in the placebo group.
I do want to, again, I believe the first study that came out of showing negative efficacy came out of Denmark. But Dr. Scott, you said you wanted to say something, then I'll turn it over to Senator Blumenthal.
Well, I just want to say, in 2020, 2021, my colleagues and I were doing absolutely everything we could to save lives, okay? We weren't using remdesivir because we were paid to use remdesivir. And remdesivir, I have to say, I never thought was, a game changer, but it's not that.
By the way, the hospitals were paid handsomely for using remdesivir.
Okay, well, I never saw that.
And coding somebody as a COVID patient as well. But
I never saw that. But in terms of, whether or not the vaccine saved lives, it's not just that one study. I mean, there's there's a Stanford Ioannidis study from that was published in JAMA recently that showed that the COVID vaccines probably averted 2.5 million deaths. So, you're cherry picking by saying that I'm, hanging my hat on that one Commonwealth study. I'm not, because I've also posted about these other studies as well. How many lives did the COVID vaccine save? I don't know. I don't know for sure. But I did see with my own eyes the dramatic decline in deaths between December of 2020 and mid-2021.
Variants did change, and Omicron was less lethal. But
Delta
was a real problem.
Omicron didn't hit until 2022.
I understand. Delta was a real problem. Senator Blumenthal.
Thanks, Mr. Chairman. I think we all know that COVID-19 had a devastating impact on families across the country. It caused deaths and still impacts the lives of a lot of people. The creation of COVID-19 vaccines through Operation Warp Speed, led by then President Trump and now President Trump, was not just one of the greatest achievements in his administration, but it changed the course of the pandemic. The vaccine saved lives and allowed others to begin to rebuild. But unfortunately, just as the vaccine became available, a lot of misinformation about its safety and efficacy spread, and hostility toward vaccines and the public health system that monitors them makes them less available. I want to ask you, Dr. Scott, you saw firsthand what it was like to treat patients when the COVID-19 pandemic began and after the vaccine was approved and disseminated. Based on the studies you've done, do you believe that the COVID-19 vaccines and others have helped save lives and been safe and effective?
Thank you, Senator. So when it comes to safety, I personally am not a big fan of the slogan, vaccines are safe and effective, because there are nuances, right? Nothing is 100% safe. Are COVID vaccines 100% safe? No. Are they generally very safe? Yes. Are they the least safe vaccine ever? No. That's absurd. Show me some evidence that indicates that.
About ready to.
Yeah, please. I'll come back to discuss that. Were the COVID vaccines effective? Yes. I mean, so 2020 was like nothing my colleagues or I had ever seen or expected. It was awful. I'm not making this up, okay? I mean, you know, it was just a nightmare. And despite our best efforts, I lost many, many patients.
Is there let me ask you, is there a reason you believe that the Henry Ford Health System study hasn't been published and has flaws?
I mean, and so one important question is, which peer-reviewed journals have reviewed and rejected this manuscript? What biological mechanism could explain vaccines increasing ear infections by 600%? Do you accept the study's null finding for autism, or only the results that support your narrative? What are the models that adjust for the massive difference in healthcare visits between groups? The analysis reports 0 cases of common conditions like ADHD. That is statistically impossible. There was a cohort of 2,000 children. There should have been hundreds of such diagnoses unless they were undetected. And let me just clarify, when I said flawed by design, I didn't mean that they deliberately, meant for it to be flawed. I just meant the study design itself had flaws in it, okay? It was methodologically flawed, not deliberately flawed, of course.
And thousands of studies have been done and published, correct?
Correct.
And let me ask you, the seeming assumption here is that this is the only study that ever has gone unpublished. In fact, a lot of studies go unpublished, correct?
Yeah. Yeah, and I review studies before they're published for a number of different journals. And
because they're subject to peer review.
Right, and it's not just
analysis.
one person. It's, multiple people are reviewing these articles, and if something warrants publication, it's, the other thing is, I've recently been reviewing hundreds and hundreds of papers for these 2 massive vaccine review projects.
And simply to be published isn't the only means to make a study public, correct? In fact,
right.
In this body, we have press conferences, we do hearings. This particular study was done and completed in 2020, and now, apparently for the first time, it's being revealed.
Right.
Has it been available during this last 5 years?
That's a great question. I mean, there's, preprints, Substacks, obviously, a number of ways to get a study out there. The fact that it's been shelved for 5 years, I think, is saying something.
Mr. Siri, why haven't you held a press conference? Why have you kept this study under wraps?
I appreciate the question. It's never been submitted to a journal, and the hope has always been that it would be submitted to a journal, because I agree with you. It should undergo peer review. It should be submitted to a journal, but they will not submit it because they don't want to get fired. That is what they told us. We've met with the authors many times. These are validly pro-vaccine individuals. They don't want their institution, the journals, their funding sources, their friends, their colleagues, everybody to turn against them, which is exactly what will happen if they even submit this thing.
But that is
for
not my
publication.
question, and I apologize
Oh,
for
I'm sorry.
interrupting because I'm limited on time. There are lots of other ways to make findings known.
They don't want to get fired.
No, I'm talking to you.
Oh, because I want, they are the scientists. They're the ones who have their name on it. They should put it out, not me. My hope is that they would put it out. I wanted the normal course scientific process to work. Look, it's a retrospective epidemiological study. Let them put it in a preprint. Let it go through peer review. Let others try to replicate it. Maybe they'll find a different result.
I'm really curious why you and Senator Johnson or another member of the Congress or members of the health community didn't hold.
Let me answer that for
Can
you.
I,
Okay? No,
can I just
let me
finish
answer
my question?
Sure, go ahead.
Mr. Chairman.
But I'm going to answer it for you.
I'm curious why, for the first time,
Yes.
we're hearing about a study which was completed 5 years ago.
Like I said, my hope has always been that the scientists would publish it, and we've tried to persuade them many, many times so it can go through the normal peer review process. I don't want to run ahead and go put it out there, because you know what that would do? It's going to happen exactly what's happening right now, is you're going to say the things that you're saying, Senator. Well, this is not going through the normal process. This isn't getting submitted to a journal. The answer to that is, I'm going to say it again, it epitomizes the corruption of science. It shows precisely why studies that show vaccines have problems never get published.
I don't think, with all due respect, Mr. Siri, that you've answered my question.
Let me answer it, okay?
And
let me answer.
Mr. Chairman,
Your
the
time's
reason
expired.
we have witnesses is so that
I
they can
understand,
answer our
but
question.
I'm part of this. I'm part of this answer. Okay. First of all, you're not paying attention to what they're saying. The people who conducted this study, highly professional, highly respected, obviously concerned about their jobs. Del Bigtree and Aaron Siri convinced them to do this study. They don't want to have their jobs put in jeopardy. But they respect the fact that these people actually did the study as they requested. When I found,
with all due respect,
let me hear.
I just want to announce, we have a vote going on. I'm going to leave to vote because more than 90 of our colleagues have voted, and I don't want to miss the vote. So if you want to hold your answer until I get back, that's fine. I really want to hear from the witness, not from you, Mr. Chairman, because we can talk to each other anytime.
I am the one that prompted this release. Once I found out about it, I said, well, if you don't release it, if they don't release it,
why didn't he tell you about it earlier?
I'm going to release it.
Why didn't he come forward and
because he felt sympathy for the authors about losing their jobs. I'm sorry, I feel the same sympathy, but this is too important to protect their jobs. This is information the public should have had in 2020, and I forced the issue. There's the bottom line. I forced the issue. So there's your answer. But by the way, you can go and vote. You're welcome to come back. This hearing is going to go on for quite some time because we're going to go through this in detail, okay?
Okay.
So this hearing is going to go on for quite some time.
As another American once said, I shall return. Thank you.
Okay. Look forward to it.